Well, in the interest of time, let's get started. For those who are yet to attend one of our live sessions, we do these around monthly as a just a way to discuss what is in the news, what is the latest, what do we need to update on, and basically just an invitation for conversation, questions. So extremely interactive, as much as we like it to be in the question side at the end. This seminar that I'm going to do now, hopefully I can do it justice in, the 20, 25 minutes that we like to keep it to as just a real intro, because it is a really deep topic and quite cultural, political, with lots of conversation and queries behind it. But it is something that I have noted for a while now, but the readiness and openness in conversation and recommendation in a whole lot of forums, social media landscapes, and also athlete conversation. I really wanted to cover this. I just felt like it was a conversation that I needed to have with my fellow dietitians, nutritionists, and those in the profession that are having these conversations because I think to be clear from the get-go, this isn't in our scope of practice. It is pharmaceutical. However, there seems to be a real disarray and misinterpretation of peptides because of that relationship with amino acids. And then it gets lumped into the supplementation safety conversation. And so I do think it's in our scope and in our best practice to be really confident with our knowledge around this, be really confident in our scope of practice, where the evidence sits, but also when it's appropriate to refer on. So when we're looking at peptides, we in this session we are really focusing on those injectable grey market peptides. And I think the big thing here is to appreciate that we don't need to be experts in peptides, but we do need to be experts enough for our clients to have a real sense of trust in our responses, in our ways of discussing this, and also a level of knowledge that then enables those conversations. So, what is driving the boom? Look, I am still amazed by this whole piece. I'm still learning. I'm still really delving in, but it's been a really great activity for me to really, get deep in this the last couple of weeks to make sure that I'm ready to present to you in this session. And, I knew it was bubbling away. And then I'm on this mums group for Newcastle, Australia, and someone was asking about weight loss. And honestly, the comment section, I was like, oh, wow, like this is way bigger and way beyond where I thought it was in terms of normalization of use. And then the more I looked at it in social media landscape, the people I already follow, there was one the other day that she was just literally just got a needle, watching that, actually just showing herself injecting, and then the old comment peppers to get more information. And it was just the simplicity of marketing and money that I was like, we need to be on top of this. And as a profession, we need to know about it to be able to hold those conversations. So, anyway, grey market. What do I mean by grey market? It is this in between like the legal market, but also like the regulated pharmaceutical market. And then you've got like the prohibited black market. So the grey market is between that, where it's not necessarily illegal, but it's not regulated either. So this is the space that we're looking into. Now, in terms of peptides, there are peptides, as we know, as practitioners, that are utilized in healthcare. Insulin is one of them, very, very needed, very well researched and essential, particularly in something like diabetes management. We've also got the boom from GLP-1s, another peptide, and then that'll escalate in terms of the types of peptides that are researched and also utilized in everyday pharmaceuticals. So I think that has one side of the boom. I think the other piece to this is the cultural element of like your biohacking, longevity, discussions, social media, access to information, and the N equals one storytelling that is so apparent, but also so strong for people to then create and change their ways of doing. And unapproved peptides are sold as things like research chemicals and not for human consumption. And the more I look into this, and Mon, you can, discuss this as well, is I find it really fascinating, and I had to really dig into the psychological element of this, of why individuals feel so ready, confident, and able to take something like peptides that are unregulated, um, versus things that are highly regulated, well-founded, and well-evidenced. And the more we really dug into that, it's really understanding that risk from a human element is assessed via feel rather than science. And I think that's where us as practitioners can take a lot from that and go, okay, well, if we know that going in, how do we then respond with an element that doesn't, really jeopardize our relationship with either our followers or our client base or our professionalism in conversation, but actually invites curiosity and a feeling of confidence within that. So hopefully this session is all about that. Now, there's lots of specific compounds when we look at the grey market peptides, lots of numbers and letters, but the big ones that we'll talk about today is absolutely the TB 500, BPC 157, and then there's a couple of others like a CJC, GHK, a few different ones. So the injectable form is what we're really focusing on here, and none of these are approved in Australia, and there's differing ways of kind of talking about that, and we can definitely work into that in terms of like UK, US, and the different markets there. Now, the biggest thing here in terms of the grey market is it is growing faster than any evidence base that we have or have access to, and we have not been trained to navigate this. So let's backtrack. What are peptides? They're short chain amino acids. Hopefully that's just revision. And that's probably why they then move into the supplement space, because I have absolutely heard comments like they're just amino acids. It's no different to, your protein powders. They're not regulated by FDA. All those types of things where it then gets lumped as a food or a supplementation product rather than a pharmaceutical. However, when we are injecting a compound, a peptide, it acts as a signaling molecule. When we are actually eating a supplement, it acts as a substrate. Very different. The injection is instructions, the eating is a substrate. So I think that's a really nice way to break it down to our clients as well, is that it is very different and it is beyond our scope. And it's able, like from that, we're able to really set a clear boundary of what we can talk about and what we can't. Um, but I think the downstream regulation and biological effects of peptides, as we've seen by something like insulin or GLP-1s, is absolutely something to get excited about and something to be very useful in certain scenarios. But in these grey market peptides, the more you dig into where the evidence is, the more shocking it becomes that people are readily injecting themselves with it. So they can be life-saving in the way of insulin, but in this way, we are actually talking about the other stuff. So the BPC 157 and also like the TB 500 are more around the healing and repair. It's definitely where we see most conversations in the sport and athlete context is what I'm trying to get at. And then we all have the growth hormone related ones, which is your CJCs and the ipamorelin. So this is in so many spaces. We see peptides being used in anti-aging, weight, muscle growth, recovery, tissue repair. Like it is entering all conversations. And then the other piece to this, I guess, is all of these, the ones that we are talking about today, are not approved, and all of them are prohibited in sport via WADA and ASADA. So I'm trying to keep this not athlete, specific, but I definitely will bring it into conversation because I do feel like a lot of you listening today will work with athletes, and particularly if you work with those that are tested via ASADA and WADA, it's worth that conversation, because I have had athletes unaware that they are a banned substance and recommended by health practitioners that they should take that in times of, say, rehab recovery, in the example of, say, an injury rehab protocol. So where does the evidence sit? This has been wild. Overarchingly, it is so limited. So unapproved peptide products have not been assessed by the TGA for things like safety, quality, or effectiveness. So when you're looking at this grey market, that is where these injectable peptides sit. They are not approved for human use and they're not regulated by the TGA. Now, this means that there's a lot of unknowns before we even get to the evidence bit. We don't know how or where they're manufactured. We don't know whether they're sterile. We don't know if and how they work in the body. We don't know side effects. And we also don't know what other substance or if the substances we expect to be in there are even in there. And that became really apparent in a recent Guardian. I think they did a full series on it in the UK, and some of the testing they did on some of these grey market peptides showed none, like zero peptides in the peptides that are being sold. So I think this is a really big case of I will talk about where the evidence sits, but keep in mind that when we're talking about evidence, it's not relevant to the grey market because it's not regulated, and we actually don't know the safety and efficacy of that anyway, even if the evidence did sit in that space. So the one that is probably best researched, most talked about is BPC 157. There is a total of 3 studies done on this, and a total of individuals that have published, like in terms of like the amount of subjects in these 3 studies, is less than 30 total. So very small sample sizes in these 3 studies. And in terms of human evidence for these uses, less than 30 people. The largest trial in this piece was around 42 volunteers, but that clinical trial actually got cancelled and was never published. And I don't know why. I would love to know why, but I do not. So evidence, oh, quite low. There is preclinical evidence on animal-based studies that shows promise in things like promoting healing and recovery, the things that we'd named earlier. But just keep in mind, this is all animal studies, so we don't know side effects, we don't know risk, and we don't know efficacy in humans. Now, the TB500, now, for those old enough, like myself, you might remember the Essendon saga, and that was very closely linked to peptide injections across multiple players across multiple years by the sports scientists, and it was a program that was also tied to the coach. So this was mainly TB500 as the peptide. We primarily only have animal data on this, and FDA have actually released safety concerns around this one specifically, and it's wider prohibited. So we don't really need to talk too much about that, but basically it's not showing any people evidence. CJC and ipamorelin, this is more like your growth hormone, IGF-1, impact, so things like recovery, sleep. We also see it in lean mass, weight loss, those types of discussions. The human evidence in this one is only in a population with growth hormone deficiency. So there is a human study done on it, but it's very specific to a specific clinical condition. And in sport, it's prohibited with reported adverse effects. So, there's not much, but also the much that we have is not great. And this is all emerging, but I think as a practitioner, knowing just how sparse the evidence is compared to how regular and common it is to take these supplements? No, pharmaceuticals, is quite apparent. Um, so when we're looking at that grey market problem, even with the evidence I just listed, we can't verify the ingredients. There is those adverse events that we have mentioned is possible, but also unknown. And even when some human data exists, like the few studies that I mentioned, we can't apply it to the grey market because these substances don't have, the dosage, the regulation, and the safety points that we actually need compared to and have with the human data and evidence. So in terms of the regulation, just to be aware, in Australia, there's no oversight from the TGA on peptides. Some health professionals may actually prescribe via a compounding pharmacy, but just know that it's still an unregistered pharmaceutical. So the oversight and the risk all gets placed on that health professional. And it's very unlikely, I think impossible to get a TUE for the use of that if you're looking at the professional athlete market. So where do dietitians sit in that? Oh, I should mention the US have actually changed more recently with peptides, with the RFK changes and whatnot. So there has been some discourse around, oh, peptides are now legal in the US. They're never illegal as such, but they still aren't regulated. So they will move from I think it's like a category two to category one, and that still means that they're um, in the grey market as such, where they're not regulated, but they are able to be made by compounded pharmacies. So that's where that sits. So still grey market, still not, regulated and high level legal, but grey market in that little fuzzy space still. Where do dietitians sit? I think the big thing here is it is a pharmaceutical. It's outside of our scope. But what can we do is where I want to focus my time. So, you can speak in the evidence base. You can be confident in your knowledge. You can keep up to date with where peptides sit and know, the rough like outline of how they work, why they're used, where the gap is, and how to refer on. You can definitely clarify the amino acid misconception, the supplement misconception. You can discuss the grey market risk. You can talk about the anti-doping risk. And you can be really confident in the appropriate referral pathway if someone is interested or already taking peptides to really support them in the best way possible for their safety, their health, and ongoing needs. So, people don't perceive these as risky. When we're looking at the feel and the trust, if we realize and appreciate that risk is assessed by feel, people don't perceive these as risky because they are generally voluntary to take. People feel in full control of this decision, but also they feel it's really purposeful. The storytelling involved with peptides is also extremely strong. The community speaks very confidently, and amino acids sound safe. So I think the risk prescription or perception, sorry, is probably the better word here, is really centered on going, we have this situation now, particularly with the readiness to share information across multiple platforms without peer review, to share very strong storytelling and create a perception of risk that is actually much lower than what it is when we look at the evidence, the regulation, and what is known. So I think these aren't going away. We are in a state where peptides are moving very quickly. The readiness for people to sell these and make money from them is extreme. GLP-1s really did open the door to the use of injectables as a weight loss tool and a health hack. And this is a really easy access point compared to, say, GLP-1s and possibly cheaper. I actually haven't looked at the costings. That was probably a bit of a gap in my research that I should have done. I'm sorry. Um, and we don't need to be the experts. I think that's a really big thing here. And, I was really hesitant to cover this topic, but I was sitting in the dark a little bit in going, well, it's not my space, which meant that I wasn't confident in discussions that I should have and could have been having with our athletes and clients to help them be more ready for this conversation and decision making. So, we can absolutely give accurate advice. We can recognize risk with them, and also we can refer. So, probably a note that I'm just thinking that I should have covered as a dietitian is one of the peptides, BPC, I think it is the BPC 157, has actually been researched and is in phase two data for ulcerative colitis, and it has shown to be well tolerated. So there is one point there, very clinical, very specific, but I just wanted to mention that because I do appreciate that I go down a sport line sometimes and miss those little clinical pieces, but something to be aware of in your clinical practice as well. Um, yeah, I think that's an overview. Hopefully, I have helped clarify a few things. Um, but yes, something I will continue learning from. So I shall now open up for questions if anyone's got some. But otherwise, I did get some sent through. Mon, if you're able to jump on, are you able to read out some of those questions? Even just one, just to get us started.
Yeah, absolutely. No, that was a really great overview. Thanks, Leash. Um, Let me see what questions I had ready from other people. One of them was how do I balance respecting client autonomy while discussing potential risks? So more of like a how to
Mm,
go about that conversation.
yeah, I think it changes depending on who is in that conversation. I find the conversation with our elite professional athletes that are tested via WADA asada is much easier because it's so much more black and white of like it's just not allowed. Done. Like it's so easy because it's so like definitive. The where it gets a little bit harder is where someone is not tested through wider ASADA pathways. There might be Gen Pop, active individual. They might be looking for, some longevity or improved recovery or any of those lean mass, body composition side of things. I think that's where it gets trickier. And it brings us back to that real importance of first hearing and listening and truly listening to what that means to them, how much it means to them, and what they're trying to achieve by taking it prior to shutting it down. I think hearing and validating story and experience is so important, and appreciating that we can hold our scope of practice beautifully in this, of really offering information if and when they're looking for it, but also referring on as soon as it's needed as well, if they're wanting more of that specific conversation and advice. So I find really simple sentences around, say, even just going, oh, that is so fascinating. This is really common now. It's absolutely booming, isn't it? Like, I can see why you're interested. Did you know that this is kind of moving way faster than the evidence? To give you an idea, there's less than 30 people that have actually, been tested and have published data around their responses to something like this in the world. And less than, it's only 3 studies that have been done on humans. It is, there's some really promising stuff. There's some great stories, and I can see why you're excited about this. But I think it's really important that we have a really good conversation around the risks and the things that we truly don't know about it as well. Um, and that's also where you can hold the risk conversation around the grey market and that it isn't regulated and we don't know what it is and we can't control. So there's kind of two additions to that conversation I think you can hold, and allowing, sorry, I think I think also no matter where we're working in food, supplementation, these types of conversations, our job is also always just to hold space for them to make the decision that's best for them. And so when you take that pressure away from yourself to tell them a yes or no, it can kind of ease that a little bit. For those who haven't attended Academy sessions before, this is just a little bit of what we do. Outside of that, we have a full community that we open up to our members, both from like the beginner all the way through to pro, to discuss these things all the time and share story, cases, questions. We also have all our research updates. And then with the pro membership, we have over 30, 35 maybe modules on all these specific topics. I don't know if we'll release one on peptides, but that feels out of scope. But maybe we'll get an expert to do that with us. But lots of different topics there to go through at your own pace or when questions or cases come up. Question 3. If people are going to start taking them, how might we be able to help them recognize if things are having a negative effect on them? I think that's a really beautiful way to like frame that. I really like that question because we can't control another person's decision. And this kind of goes for whether you might be talking to someone who's already taking them, or someone who has decided to take them, during the time that you're working together. It's really important, first of all, to document your discussion, what has been covered, and ensure that you've got documentation in that way. The reason I say that is because it's unregulated. All risk goes on the practitioner that's recommended or the source that they buy it from. So just really keeping that in mind that we actually don't know adverse effects and risks. Um, I think being really aware of the different symptoms of different types of peptides or risks of peptides can be really helpful there, and you can make them aware. So when you want someone to be aware of something and notice it, you can actually say, "Hey, these are the things that we're aware of may happen. If you notice changes in da da da, it's really important that you reach out to." a health professional, not you, or a medical professional, you can absolutely say, you can bring that to me and I can refer you on. But just wanted to make sure that you're aware of things that you need to be taking quite seriously and also considering if you're going to go down that path. Um, yeah, I think the wild thing is we don't even have dosage data. Like, I find that really, really fascinating that we actually don't have anything to guide intake. Do you know where? I can definitely find that, Beck. I think I didn't go into the like I was really worried about time, so I was really proud of myself not to go over time. So I didn't go into that. But when you're looking at the different types of peptides, you can absolutely access it in the journal papers, both the preclinical ones and the human ones. They do risk some, oh my God, do list some risks and adverse effects that were in if you wanted to go really deep. But yeah, I can definitely try and dig some up. But yeah, I came across them, but I would not be confident in going, this one has this and this one has that, because there is definitely differences. And one thing I noted was depending on the type of peptide, there was actually like flags for adverse reactions on some and not others. So I think there is a difference in response and risk depending which one. So it may be that depending on the type and specific type, your response may actually be different. So sorry, that kind of complicates it. Yeah, and
Had a
dosage.
question on around when it comes to how important education is when it comes to
Mm,
peptide use in terms of
mm,
obviously dosages. I've heard of people having incorrect doses, like you said, or even injecting air because they don't know how to
mm.
inject themselves. So, as dietitians or nutrition professionals, the question is, do we have a duty of care to encourage clients that are already taking them to seek safety education on how to use them if they haven't
Mm.
already?
Yeah, that's a really good question. I don't know where it stands with our risk in practice and the medico-legal side of that. That would be a really interesting thing to dig into. I feel like it does link in beautifully with the risk chat though, of like if you are already down the path or you're looking at deciding, I'd highly recommend and can refer on to a medical professional that can help guide you in the safest way to do this. I really do worry though, like around, is there even access to medical professionals that will do that with someone considering the possible risk to practice? Yeah, I find it really, and that's really why it's so grey and grey market in all areas because the information is being given, the sale is being done by people who aren't trained. In a lot of cases, it's something that is done by people making money off it. And now, if you look at the peptide market in the social media landscape, it's now people selling it from their profile to get a percentage of the sales. And so it's almost moving into this pyramid scheme to an extent where there's a marketing opportunity and a money opportunity for anyone who, in particularly in the influencer community. So, yeah, I think it's going to get messier before we actually come up with a better plan. And I think some of the conversation may be, well, do we just start to regulate it so we can, gain back some control on this market? But you can't regulate something that's not studied. And so we're in this really awful state where I think we're a really long way from actually getting a hold of this. And I know the US tried to get a hold of it by making it, that illegal kind of piece that Australia is kind of still in, where you can't readily make it and prescribe it. But then they tried to get that back this year to say, well, you can make it and you can buy it, but it's still unregulated. But it's just creating this market that's booming at a time where we're still really at a standstill with the research. I couldn't find, and you know how when clinical studies are being done, you can find which ones are being done, like you can see what's actually in action. I couldn't find much happening. So, yeah, I'm really worried that it's actually just going to continue and be messy, which is hence why we've got to talk about these things. Oh, no worries at all. Thank you so much for joining, guys. Yeah, so if I'm aware of time, so if anyone has any other questions, please shoot them through. But otherwise, I hope you've enjoyed. I know it was a bit of a different conversation today, and one that is just more around knowledge, being power in those conversations, and power not in a negative term, but power in a real empathetic, meet that person where they're at term of holding that space for someone who is obviously trying to achieve something, and giving them the information that is actually evidence-based and a whole lot more clear. And clarity and kindness go together in that way. So hopefully that's helped. But yeah, it's a space that I think we can continue to work on and also see in practice. But yeah, it's not as black and white as it is in sport. Sport, very black and white. General pop, active individual, very blurry. And I think particularly something like masters athletes, I see this as a piece where they're looking for that edge, they're looking for that addition, they're looking for the longevity and wellness space. And it is kind of that thing that's within that market. So yeah, fascinating. Thank you so much, everyone. Thank you. We'll send the recording. Bye, guys. Thanks so much for joining.